Okay, so today is going to be a demonstration on how to stretch the adductor group. Okay, the adductor group, basically, we'll use this muscle here. It attaches from the pubic bone, okay, and it originates on the pubic bone and then inserts onto the femur and also inserts onto the tibia, which is the pes anserine. The gracilis is the muscle that attaches onto the pes anserine. Okay, so when we stretch the adductor group, okay, this muscle, again, if it's, we'll try to connect it the way that it should be, it's going to be a little bit more taut, okay, with regards to, I'm sorry, it's going to be a little bit more slacked if it's into adduction, okay, adduction. It's going to be a little bit more slack. You may be able to see, you may not be able to, but when we bring the muscle or the leg into abduction, right, when we bring it into abduction, it's going to become much more taut. Okay, so when we stretch the adductor group, remember the adductor group, and when it contracts, it's going to adduct the leg across, right? So when it contracts, it's going to pull, and it's going to adduct the leg across midline. So with the adduction that occurs, we have a stretch of the abductors, which are out here. When abduction occurs, so when the abductors, like the G medius, pulls the leg into abduction or abduction. Remember, abduction means to take away. When it pulls it into abduction, the adductors, the adductors, are going to go on stretch, which is the groin muscle or the muscles of the groin. Okay, so I'm going to show you and demonstrate to you today how to stretch the adductor groups, the adductors. Okay, so first thing is, when we decide to stretch the adductors, as a trainer or as a doctor or physical therapist or whatever it is that your occupation is, and even a strength coach, right? Obviously, a big part of their job is to make sure that the athlete's warmed up and so forth, and even a personal trainer. The biggest thing is to determine what their flexibility is. So again, as I showed you with the hamstring, we would check and obviously pull it up and let me know when to stop, right? Same thing with the quadriceps. Same thing here with regards to the adductors. But with this regard, I'm going to bend the knee like so, and I'm going to use my hand underneath the heel right here. I'm going to put my other hand on top of the knee, and I'm going to stand beside the leg. At that point, I'm going to just gradually abduct their leg into abduction, which is going to stretch the adductors. I might get to this point and it's already enough. At that point, I would potentially put their foot on the side, on my side, okay, and hold it there. I could use the lower portion of my abdominal area and still hold the leg in that position. Most often, individuals to stretch, when we do stretch them, individuals, we can actually get them into this position. So I would say, okay, let me know when to stop, and I would put their bottom of their foot right on my hip, right on the superior portion of my iliac crest. So I'm going to put it on my left side. The right leg, I'm going to put it on my left side of my iliac crest, so my left pelvis innominate. At that point, I'm going to just basically put their bottom of their foot onto my pelvis and then my hand on their knee, and I'm going to hold like so. 30 seconds, I would hold for 30 seconds. Then I would ask them, okay, I'm going to push down a little bit more. Let me know when to stop. So I'm going to push up and let the leg drop a little bit more. So I'm going to push up. So I'm going to exaggerate. I'm going to push up this way, not that far, but I'm going to push up just a bit and let the leg drop. That's the next 30-second hold. I hold for 30 seconds. I then inform them I'm going to push down a little bit more. I push down a bit more, or I let it drop a little bit more. Remember, it's a heavy leg, so most often there's going to be a lot of resistance. So I'm going to push down a little bit more, let gravity pull the leg down. Keep the foot right on my hip, and I'm just going to let me know when to stop. Stop. Another 30-second hold. The foot will rest on your iliac crest of the pelvis on the left side comfortably for the most part. It's not going to slip off most often. 30 seconds. And then I slowly bring them back up into their neutral or to their regular position. Okay. And then I would perform this on the left leg, on the other leg. Now, when it comes down to this particular muscle, there really isn't typically a different level of flexibility. Okay, so if it's just this much, we still hold and we allow them to 3-second pass. If they can get a little bit more, right? So we'll push up into abduction more, and it's just a little bit more of an intense movement or a little bit more range of motion with regards to this stretch. So there's not like a 3 or 4 different levels of flexibility. Most often, not a lot of people are flexible in the adductor group. Okay, so most often we all have some limited flexibility with this muscle. But with that being said, there are different methods of stretching the adductor group. So we can do that particular model or that particular type or way of stretching, method of stretching. We also can try, and this works too, right? We can also do 1 foot on the side, okay, or 1 foot on the table, and then what we do is we just allow the leg. We hold the foot. We would sit on the foot potentially on the bottom of our leg. We'd sit there, and then what we would do is we would allow gravity to pull the leg into abduction, which is going to stretch the adductor group here. Okay, so we would just let gravity hold. We'd hold it. Okay, let me know when to stretch. Let me know when to stop. Stop. There might not be any more push for gravity pulling it. So then we would push a little bit more. 30-second hold. Okay, let me know when to stop. I'm going to push down a little bit further. Stop. Another 30-second hold. The other opportunity would be obviously the next phase, the next pass, I should say. Another 30-second. Let me know when to stop. Stop. There's your third 30-second hold when stretching a partner or stretching somebody else. This is another type. Okay, so what we would do is we would basically get up on the table. Okay, and what we would do is we would put their feet on the table. We would straddle their feet. Okay, like so. So 1 foot, 1 knee. I know it's black and black, so it's kind of not as transparent. 1 knee is on the black, is on 1 foot. The other knee is on the other foot. And then at that point, we would inform them. It's basically a bilateral stretch together. It's very similar to what many of you have done already. It's just considered in normal terms of butterfly stretch. And what we will do is, because there's going to be a lot of resistance, right? Especially if they're very, very inflexible, we would allow the legs to come to separate from, not be in close proximity. We would allow them to separate. And then what we would do is we would slowly we would slowly push down both legs into abduction to stretch the adductors. Now this is most often very uncomfortable stretch. So, and a lot of times they're very, very inflexible when it comes down to both legs at the same time. Much easier to stretch one leg at once and then the other leg, you'll find that there will be more flexibility with one leg and the other if you do it individually compared to simultaneously. But this is still a good option. And what we would do is we would pull, put our hands on the inside of their knees, and we would tell them, okay, I want to push down. Let me know when to stop. Stop. 30-second holds. Then I would push again. Let me know when to stop. Stop. 30-second hold again. After that 30-second hold's done, push down a little bit more. Let me know when to stop. Stop. And then that would be the third 30-second hold. This adductor stretch is not going to be a lot of movement. Okay, so what will happen is, and I tried to emulate as best I could that there won't be a lot, right? So it'll be like stop, let me know to stop. It's a very small range, right? So the next time is stop, and then the third pass would be maybe even that much, which is okay. Some individuals are a little bit more flexible. So what you can do, right, is you can push their heels up as close to their glutes as possible. Okay, as close to their glutes as possible. Get it so their heels touch their glutes. That's fine. And then you're going to scoot up a little bit. And then you'll do the same thing. Okay, and these individuals may be a little bit more flexible. That's okay. And they might be able to abduct both legs bilateral at the same time, much more than other individuals. So the same thing. Obviously, it's not going to fall like that, right? Because there's no muscles holding up these. This is just a skeleton. So I'll just try to do it as best I can, emulate. So it'll be about here, and then we would 30-second hold there, push down. Let me know when to stop. Stop. And sometimes, even with this particular flexibility, you're using like you'll use a thumb. Like it won't even be. So let's just try this. So it'll be like a thumb or a finger. You're not even gonna. Sometimes you won't even use your hands because you can't feel how much you're pushing. So you'll use a fingertip, right, or a thumb, and it'll just be easy push. Let me know, stop, right, and then they're like, oh, that hurts, and then it's a hold for 30 seconds, and then the next thing is let me know when to stop, and then there will be it'll be a slight push. A slight push, and then that's your last 30-second hold. Something else I think athletes, patients of all ages, genders, etc., really like is some joint mobilization at the hip. Okay, so I'm going to add that to this. Okay, so what you can do a lot of times in this, it's an addition to the adductor stretch, is just once they get to the point to where this, by the way, this is great. Like they love it, right? They're like, oh my gosh, can you do that again, Dr. Mercado? And so what'll happen is you grab their heel, grab their knee, and then what you can do is it's just a slight, it's a nice stretch of the joint. It's a nice stretch of the muscle. You can put your the heel on the hip, and it's just a really nice, gradual, just mobilization technique. With regards to stretching, really helps stretch the joint, really helps stretch the adductors, and really helps those muscles loosen up quite a bit. So that's the adductor. While we're here, I'm going to show you the abductor stretch also, because this is a good way to stretch the abductor as well while we're here. So you're going to do adductor and abductor. And so the abductor is obviously on the outside. It attaches like so. Basically, this is the muscle here, the G-med. It attaches onto the lateral portion of the iliac crest, or the ilium. So it originates on the lateral portion of the ilium, and it attaches to the femur. Okay, kind of like so. Right, we'll do the best we can to make it look like a muscle that attaches. Right, and so when it contracts, it's gonna pull that muscle, that bone out. So again, when it contracts, it's gonna abduct it. Okay, so what? And then obviously the adductors are going to stretch. So what'll happen is when we stretch the abductors, we're gonna pull the leg into adduction. And as we pull the leg into adduction, the muscle is going to stretch, right? So we're gonna pull the leg into adduction, and then this muscle is now gonna be on stretch. So again, when we pulled into abduction and the muscle contracted, we're gonna have this adductor, do it this way, and it contracted, we're gonna have these adductor muscles stretched. So now we're gonna ask the adductors to do the work, right? And it's adducting, and now this muscle is gonna stretch. So what we're gonna replicate is we're gonna actually replicate a deduction, right? To stretch the abductors. So a very good stretch and an easy stretch to do, right? When we stretch the abductors is to bring the knee up and bring the leg over. Now we bring the knee up and we bring the leg over. A lot of times that becomes a little uncomfortable, and for the athlete or the patient or the client, and it's difficult for us to lean over, right? If I lean over, my back is bent forward. It's not good ergonomics for me as somebody who is working on individuals with stretching and so forth. So what you would do, let's see if I'll try to use this leg. It's probably a little bit easier to show you. So what we will do is instead of pushing over like so, we're gonna so if I'm on the right side of the individual, I'm gonna stretch their left leg. If I'm on the left side of the individual, I'm gonna stretch their right leg. So for demonstration purposes, I'm gonna show you how it looks to stretch the left leg. Once I'm done with the left, I would walk over to the right side of the table, and then I would stretch the right leg. So we're gonna do the left leg to start. And so what will happen is I will bend the knee and I'm gonna bring the leg into adduction, okay? And at this point in time, if they are not very flexible, so this is a little different, right? So if they're not very flexible, what I would do is I would get up on the table with them. Their leg's gonna be on this side. And then what I would do is I would bring their leg up. My foot's gonna be here. I can either rest their leg on my leg, okay, and hold it there. Okay, that would be all I would do. Then their third pass basically would be, or I could hold their leg here, and then I could bring my knee up. So just for simplifying it, we'll put their foot on your knee and hold their leg there, and we're gonna put our hand on their knee, and then when they're ready, we're gonna lean our body forward. Now that becomes a little bit more difficult for me, so I'm gonna put my knee up a little bit higher, okay, and I might put my glute on my shoe. And then if that's the case, then what I would do is I would lean forward like so, okay? Push forward like so, a little bit more. I could do a lot with my body on working that leg so that it stretches it well, okay? So the other thing is you can be on the side of them for those who aren't very flexible. But the problem is when it comes down to this is that I have a lot of arms. I have to use my arms a lot, right? So I don't want to use my arms a lot. I want to use more of my body. So sometimes we can, let's see, got on this side. So it's just showing you different options. And then what I would do is I would stand next to them like so. I don't know if you guys can see that. Probably not. Maybe on this side. So I would bring them this way, hold it, and then what I would do is I would just lean them forward just a little bit, right? So I can stretch them out and I can just basically lean them forward, and then that's enough stretch too. Okay, so You can get up on the table and stretch them that way. As long as your back and your body doesn't feel like it's doing too much work, you can slide them over onto the side, bring the leg up, okay, and then just use your hands to push their leg just a little bit, right? But it needs to be, we're trying to get into this adducted state to stretch the abductors on this side. Okay, so that's for individuals who are not very flexible. It's pretty easy to stretch them with regards to those flexibility. It's not a very difficult thing to do. With those individuals who are somewhat flexible or more flexible, what you would do, we'll do the left leg, like I said. And what would happen is you would bring their leg around, and then what you would do is you would put the side of their ankle on your hip. You're gonna put, you can use a table for this as well, another hand on their knee. And then what you would do is you would use your body and your arms to stretch them push them into adduction. So it stretches the abductors here. So you're gonna use, this is the easiest way, I think, for those who are more flexible. Some people, let me just jump back. Some people are not very flexible. There's not a lot of movement. Some people are a bit more flexible. So what you would do is you could put your body in between their right knee, bend their right knee, and then you're gonna basically kind of wedge yourself in between their left leg and their right knee. Okay, so you would kind of wedge yourself, and you would use your body to wedge yourself between their left leg and their right knee. And then you would just use your body. You don't even use your hands. You hold the knee here, hand on the knee, another hand on the foot, and you would use your body in between. You'd use your body. So first 30-second hold. Sometimes it's like you got to squeeze yourself in. First 30-second hold. Okay, let me know when to stop. Stop, and then I'm just using my body and my hips and my legs to push, right? So this is exaggerating. So no hands, it's just body, right? And then I even might want to slide my feet a little bit, which you can't see, but if that makes sense to you. So second 30-second pass, okay, let me know when to stop. Stop, 30-second pass, okay, would be someone who is moderately flexible. More flexibility would be an individual who can get their leg up and over, and now we can get our body in between the outside of their left leg and the outside of their right leg. I'm sorry, the outside of their left leg and outside of their right leg. And then we would use again our hip and our hands to allow for leverage. And then now there's a lot more space for me to get in, right? So it's not me wedging myself in between and working it just a little bit. You can see here's I have a pin here, so you can see here's the lateral portion of the left leg right here, lateral portion of the right leg right here, and there's not a lot of space. I mean, it's maybe a couple inches. Okay, so I'm just gonna barely use my body to create more separation, right, between the left leg and the right leg. So less separation, more separation. My body does all the work. No hands, no arms. I'm not tired. It doesn't fatigue me out or anything like that, make me feel like I can't stretch anymore. The most severe or most extreme stretching or flexibility is when someone can actually, now we can get in between the outside of their left leg, right leg, and the outside of their left leg, right? So now it's much more, it's much easier for me. So now what I can do is I can allow gravity to pull down, right? So they're still feeling a stretch in this area. Now I'm using gravity and their legs kind of hanging, their foot's hanging off. And I'm using gravity to just allow the gravity to pull. And then I'm going to say, okay, let me know when to stop. And I push more, stop. Hold 30 seconds. Let me know when to stop. Stop. 30-second more. Let me know when to stop. Stop. Okay, 30 seconds more. So I'm really getting good flexibility. If I don't bend the knee and keep the leg down, what happens is I try to push, the whole pelvis rolls, okay? And then we don't even get a stretch of this muscle. Remember, we need the insertion point here and the origin point here, right? The origin point here. We need the insertion point, the origin point to basically separate and not become so close and approximated. So if we put the leg down and we rotate and we try to do it, everything's gonna roll, okay? So the femur and the ilium, the femur and the pelvis, and on it is just gonna roll together, right? There won't be any movement, approximation, or separation of the insertion and the origin point, right? So we don't want it to roll. So if we don't put that knee up and we do that, everything rolls together, and then we end up with like a different stretch, like of the back, whatever it might be. Okay, so we want to really put that knee in this position. It's going to allow more leverage. It's going to allow us to wedge it, and then it prevents the whole torso or the whole lower body from rolling together. Okay, so that's for the most flexible individual with regards to stretching like so. Okay, so that completes my demonstration of how to stretch the adductor and the abductor on a partner.